So what I'm going to do is go ahead and open up the public hearing on 608. Drew, if you can give us the overview.
Thank you, Mr. Chair and committee members. Senate Bill 608 establishes the Rural Medical Liability Stability Fund, Subsidy Fund, and places it in the State Treasury, appropriates monies from General Fund to Oregon Health Authority to develop and implement program, directs Oregon Health Authority to subsidize physician malpractice premiums for certain rural physicians and nurse practitioners along a scale determined by practice area, and takes effect upon passage.
All right, thank you. Now, my understanding is that we're going to take public testimony today. Apparently, there's still some work ongoing that we're going to need some amendments to it, but we felt this was an appropriate time for us to get the stuff on the record, and then we can move forward. And Senator Bates, is there anyone else you'd like to have part of a panel, or did you want to solo?
Invite anybody else who wishes to testify on this bill to come forward right now, okay? And sit up here with me.
All right, but why don't we go ahead and
I'll start it off.
Start off, and then we'll bring up the next set.
For the record, I'm Senator Alan Bates, District 3 in Southern Oregon. And to be clear about this, this bill does not directly affect me. I am not in a rural area. So you may also know that I'm a physician in primary care in Southern Oregon, and that should probably be on the record also. I'm going to give you a little history on this if I could, just for a few minutes, and bring you up to speed on it so you can have an understanding of the situation and what we're really trying to accomplish with this bill. About 4.5 years ago, Governor Kulongoski and I and some others sat down and talked about the difficulty we're having in rural Oregon maintaining health care in those areas. We had a steady erosion and loss of primary care physicians. We had a loss of nurse practitioners. We were losing the ability to do obstetrics in regional areas of rural areas of the state. And we were actually losing what I felt was the fabric of rural parts of Oregon due to a lack of health care in those areas. We also looked at it from the point of view of economic stimulus. When you lose your physician, when you lose your nurse practitioner, when your hospital's at risk of closing, when you can't do obstetrics and other basic things you need to do in rural areas, you find it's very difficult to get industry to come in and have jobs there because nobody wants to move to a town or a city where the nearest health care is 100 miles away. So we started looking at the things that we could do to help stabilize the workforce in those areas and what could really make a difference. Well, there are other bills and other systems and other programs to try to do that. One of the ones you'll probably hear about is loan repayment, which has been effective to a degree, but the problem with loan repayment we commonly run into is once that loan is repaid, after 4 or 5 years, the nurse practitioner or doctor in many cases leaves the community. At least they had them for 4 or 5 years, but it's not a permanent situation. We also deal with our A and B hospitals in a way that they get paid for costs, which is something we also need to maintain. What this bill has done, though, is been the first time we've seen a stabilization. It has been very, very effective for the last 4 years to have a program running in rural Oregon where we subsidize the medical malpractice premiums paid by physicians and nurse practitioners. And putting this program together 4 years ago, we really went through some difficulties. And I see Senator Cruz smiling there because he was part of those discussions. We had a very difficult time of defining what rural Oregon really is for the purposes of this program. And I want to point out some things about that are important. First, think of rural Oregon. Think of areas in far eastern parts of the state or on the coast or other areas. There's another overlay you have to lay on that kind of a map, and that overlay is what does the patient mix look like in those areas. And this may be a little down the weeds for you, but it's important because it relates directly to this program. In most places in rural Oregon, you have very small amounts of what we call commercial insurance. These are insurers that pay 2 to 3 times higher than what Medicaid or Medicare pays. And so when you're in a community that has a very small amount of commercial or no commercial insurance, most of the patients you're seeing either have no insurance, they have Medicare, which pays very low rates in this state, or they have Medicaid, which pays low rates. And so one of the problems for people in rural parts of the state who are practitioners is just making a living, because people are in a situation where they really can't pay the kind of salaries that physicians, nurse practitioners can make in big cities. Plus, the work is harder. You're up nights and weekends. You may be the only one in that community that's giving health care. You're on call 24/7. And makes it very, very difficult. So an ongoing program that reduces your costs, and one of the major costs in running a practice in those areas is medical malpractice insurance, one that continually reduces your overhead is very significant, not only for recruiting people, but for keeping them there. And when I talk to our managed care organizations in Medicaid, I ask them, what's the most important tool you have for recruiting and maintaining nurse practitioners and physicians in the rural areas of the state? They say this program is the #1 that works for them the best. It keeps people there, and it's a great recruiting tool for them, and has stabilized our rural population of providers. So you may see and you will see some minor changes coming through on this as far as amendments are concerned, but the basic program is, I think, is as I have outlined it for you this morning. We want to maintain this program. We want to keep it going. We want to keep the same areas being covered to be covered in the future. The real question here, frankly, is not this bill. We do need this bill to be passed, and I appreciate giving us a hearing, and I hope you'll have a work session very soon. The real question is something that's not in your hands. That is the funding for this. It's going to be very difficult to find. It's not really that much money. When you think about the healthcare industry in the state of Oregon, it's a $22 billion a year business, and we're talking here of probably somewhere in the neighborhood of $6 or $7 million a year to pay these subsidies. We need to find that money, and it's going to be a job for another part of our system, which I think probably is going to be end up in my committee down in Ways and Means. So I would encourage you to please look at this bill very, very carefully. Place whatever amendments you think are appropriate into it, but we want a bill coming to us that does the job we want to do. Our real task here is going to be funding this program and keeping it funded, and we're going to work very hard on that. Thank you.
All right, thank you.